Hello everyone, welcome to another series in pharmacology. So for this day, we will be discussing about the guidelines of making a drug study. Okay, so for every rotation, you will be assigned to a patient, and then that patient, nana siya yung mga list of medicines or prescribed medicines or ordered medicines from the attending physician. So if your patient is taking a maintenance medication sa balay, so dili siya labuton sa drug study unless i-appeal siya sa i-order or i-prescribe ni doctor during the course in the ward or during his admission in the hospital. So, most of the CIs, mga 2 or 3 to 5 ka-drug studies ang ilahang i-require for every rotation nga mahitabo. So, for each drug nga i-submit, you will use the following rubric para score, or we will use the following rubric, this one, para mahibaw-an nato kung unsaon pag-score. Okay, so the score of the drug study will be in accordance to the description of each criterion. So we have here, okay, one moment ha. Dapat na dito ang mga assigned drugs, okay? Ang dapat i-include sa drug study kung unsa tong listahan sa mga tambal nga gi-prescribe or gi-order sa doctor. Second is the quality of the information. So dapat ang information is it would clearly relate to the main topic. So it includes several supporting details and or examples sa mga, for example, na mga signs and symptoms or for the indications, ibutang dito tanan. Okay, so if dili siya necessary sa sakit ni patient, ayaw ibutang. Okay, if dili siya ma-apply sa sakit ni patient, dili siya ibutang kay mahimong taas kayo ang drug study, okay, pero dili siya ma-relate kay tungod wala si patient naka-manifest ani nga symptom or dili na mao, although naa siya sa indication pero dili kadto tanan, okay, dili kadto tanan nga mga symptoms or ang specific nga disease ang naa si patient. Okay, and we also have the amount of information. So we also have the accuracy. So dapat complete yun ang atong drug study, no? So all facts dapat precise and explicit. In the organization of the drug study, so dapat organize good ang pag-create sa atong drug study. I-edit nato siya nga sakto og margin, sakto og kaning pag-justify. Okay, dili magbulag-bulag. Okay, so dapat nindot siya lang tawon. Okay, kung kinahanglan ang kanang mga, like for example, the list of the adverse effects. Okay, so butang na to in alphabetical order. Okay, ano siya sa pag-organize. So we have here sa atua sa school nga gi-adapt nga drug study. Okay, we have here the drug name, the route, the dosage, the frequency, the indication, the mechanism of action, the contraindication, the side effects, the nursing responsibility, and the patient teaching. So supposedly your nursing responsibility and the patient teaching lahi siya nga column. Okay, but diri siya ato ang gigamit nga drug study is giusara siya. Okay, so for the rubrics or for the guide in grading your drug study, ako alam po na siyang ihatag sa inyo ha. Okay, para guided mo unsaon pag-create sa inyong drug study. Okay, so again, mag-start ta. So dapat ang heading din ha. We have the drug name, the route, the dosage, the frequency. Okay, so by the way, under the drug name, we have the generic name, the brand name, the pharmacologic classification, and the therapeutic classification. And under sa ato ang therapeutic classification, na-added to ang ato ang picture sa tambal. Okay, in memes.com, mag-upload na sila og mga pictures. Okay, exact picture kung unsa gyud nawong sa tambal. Okay, unsay mga marking sa tambal nga makita ninyo when you buy that certain medicine or inighatag ninyo ana niya nga tambal ngadto sa patient. Okay, so ang color, ang Ang usa siya nga form. Okay? Naabay mga markings, makita nito sa picture. Okay? So, by the way, our reference in collecting drug information para mas dali, nagamit ko og memes. Okay? Drug handbook, pwede gihapon na siya gamiton. Ang katong memes nga book na to, pwede gihapon na siya gamiton. Okay? So, mas easy, nasa memes.com, or kung wala sa memes.com, nasa filipinodoctor.com. Okay? So, we have the second column. We have the route, the dosage, and the frequency. And the next, the indication, para unsa na siya nga tambal. And we have the mechanism of action. Okay, and then next to that is the contraindication. It's adverse effects and side effects. And we have the last one, ang nursing responsibility or ang patient teaching. So, muna akong giingon ganina, supposedly, ang nursing responsibility and patient teaching, pwede na to siyang ilahi. Pero ang ato ang gisunod nga form is usa siya. Okay, so we will stick to that form na lang. So, mo to siya ato ang gamitan nga form. So, in here, naadinhi ang, this is memes.com. Okay. So, dira na ko. Kung naka-sign in na mo, okay, pwede mo mag-sign in daan kay kung sa browser lang man mo mangita, no, kuan siya, isa-isa, dayon, isa ka tambal, mo prompt siya o kinahanglan mo mag-login. So, mag-create na lang mo og kuan daan, account daan sa memes. So, let's say for example, I have circ. Okay, so, i-show na ni memes.com ang information ni circ. Okay. So we have there, so we have there the generic name, the manufacturer and distributor. We have the contents, the indications. So kung i-click nimo na siya, kanang mga red na siya detailed information nga makita nimo. For example, kana siya. Oo. So we have the indications and the uses, and we also have the dosage and the direction for use. Okay. So, depende sa formulation, depende sa strength, sa dosage na to. So, by the way, kana di siya is kuan. Ang katuato ang indication and the dosage, mag-refer ta dito sa gihatag ni doc nga timing, nga frequency, ang pila, ang strength sa tambal. Okay? Basihan nato ang naa sa order ni doc. Okay, naas nga gibutang sa chart. Okay? So, for the purpose lang of completion, no, since wala pa man ta naka-duty dyan sa hospital, so, ibutang lang nato tanan nga mga indications, possible indications, sample nga mga dosage and frequency dito sa ato ang himuon nga drug study. So, we have the description, the action, the beams classification, and then we have there the picture, yung formulation, yung strength, we have 16 milligrams, and then mga markings, okay, and how the size also of the tablet, okay, and also the price. Okay, the price. Kaya siya dollar rin siya nga price, SRP. Kaya gina-update man nila ni from time to time. So, we have here. So, ato ang unang buhaton kay ato ang i-butang or ato ang i-complete ang drug name. Okay? We will complete the drug name. Okay? I-fill out nato na siya. Okay? Or fill in with the information nga nakuha nato sa memes or sa drug handbook. Okay? So, we have here an example, the beta-histine. Okay? That's a generic name. By the way, in writing a generic name, dapat di ay mas lowercase siya. Okay, lowercase ang first nga letter sa ato ang generic name. And then for the brand name, we have there circ. Okay, its pharmacologic classification is it's a potent H3 receptor antagonist and a weak H3 receptor antagonist. Okay, therapeutic classification, kabalo na ta, para asa siya, it's anti-vertigo. Okay, so moving on to the route, the dosage, and the frequency. Okay, so sa route, sa dosage, and sa frequency. Now, ang atong ibutang sa route, dosage, and frequency again is kung unsa tong gi-prescribe or gi-order ni doc. Okay, for example, kana siya, as ordered, give 1 tablet by mouth now and then 3 times a day. That's circ 16 milligrams tablet. And for the timing, we have the 8 a.m., okay, 1 p.m., 7 p.m. So that is hospital protocol ni siya tong kuan gamiton para sa tong timing. So na may ibang hospital nga mag-timing sila sa ilahang 3 times a day o 816. Kay na pa ibang hospital 817 p.m. Okay, duration unknown kay wala man na may mga doktor no nga mo kan sila nga good for 3 days lang. So since wala ning gi-indicate ni doctor kung pila siya ka days dapat imnon, so butan na nato ang duration as unknown. So other forms, okay, based sa gi-prescribe ni doc, no other than tablet. So for the indication, we have there Meniere's disease, vertigo, Meniere-like syndrome characterized by attacks of vertigo, tinnitus, and sensorineural deafness. Okay, so kana nga mga indication is na experience na sa ato ang patient. So for the mechanism of action, we'll just simply copy the mechanism of action from the website or from the book. Okay, then you check the spelling and you correct it. So next to our mechanism of action, we have the contraindication. Okay, so when we say contraindication, kanus na siya dili pwede ihatag, okay, nga drug sa ato ang patient. Okay, so for SARC or for beta-histine, ang contraindication niya is hypersensitivity to the active substance or to any of the excipients. And we have the pheochromocytoma. Okay? So, usually, ang contraindication gyud sa mga tambal, kasagaran nga contraindication gyud sa tambal, balik-balik ra na siya, hypersensitivity to the active substance or to any of the excipients. Okay? Hypersensitivity, drug allergy, okay? Because it may cause a severe allergic reaction. For the side effects, we have adverse reaction, okay? So, kani siya by system. Okay, for example, in the integumentary system, a patient may experience rashes for the GI, mild gastric complaints or abdominal pain, and for the interaction, okay, this drug study or this drug, the beta-histine, okay, pwede na siya mo interact with the antihistamine, okay, antihistamine. Okay, so it may affect how beta-histine works and may be affected by beta-histine since kanin siya is pwede siya mo potentiate, okay, mas mupagrabe sa effect sa beta-histine or mas mupagrabe siya sa effect sa antihistamine. So ang patient mo ani if na ay gamitan ni siya og another nga antihistamine, ang kanitong beta-histine is drugi kay ang patient. Okay, katulgon. Okay, for the nursing responsibility and patient teaching column, okay, we will indicate there for the assessment. Actually, ang nursing responsibility and teaching column, ibutang nimo ang kuan. Unsa ang nursing responsibility at the same time ang iyang rational or rationale nga nung i-observe nato na siyang nursing responsibility. Okay, for example, we assess the patient before therapy and regularly thereafter. Okay, our reference is the Student's Drug Handbook. Okay, 2009 version, page 10. And its rationale is to indicate baseline data and monitor drugs effectiveness. Okay? Because there are patients taking beta-histine nga, dili na sila madutlan. So, i-ask na to sila if nakatake na ba sila og beta-histine or wala pa. Or unsa ang effect sa beta-histine sa ilaha. For example, the patient will experience or had experience hypersensitivity to the drug. So, i-ask na to ang patient ana. So, we will assess the patient's drug history and calculate the total daily dosage. Okay, accordingly. So, again, if nakatake na si patient, ani nga tambal, okay, i-ask na to siya. Okay, kung pila ang usual nga dose nga iyang ginatake or gina-prescribe sa doctor sa iyaha. And then, okay, there, our responsibility plus the reference and then the rationale. Okay, actually, taas-taas ni siya ang nursing responsibility and patient teaching. Now, kung dili ka sa ego, ibutang siya sa next nga page. Okay, butang siya sa next nga page. The nursing responsibility and the patient teaching column is very important kay dinha nato mahibaluan or nato ma-assess ato ang patient if ang therapeutic regimen nga gihatag sa iyaha is effective ba. Okay? So dira nato makit-an ang or dira makit-an nato ang purpose, okay, sa nursing action nga atong gibuhat in terms of pharmacologic intervention sa ato ang patient. Okay? So, mo na siya for the nursing responsibility. Now, if dili siya masaigo, dayon ibutang nato siya sa second page sa ato ang drug study. Okay? So, for the purpose of documentation lang no, gibutang lang nako nga tulo ka buka to ang nursing responsibility. Okay? And then actually daghan pa na siya. And then we have there the patient teaching. And patient teaching nato is daghan pa gyud. Daghan tag pwede mabutang dinha. Okay, so asa nato ni makita ni nursing responsibility and the patient teaching? Okay, pwede ni siya makita nato sa memes. Okay, makita pod ni siya or mas elaborate dito sa nursing drug handbook. Okay, nursing drug handbook ang kaning nursing responsibility and patient teaching. Okay, so example there, if a patient misses a dose, tell her or him to take as he or she remembers, but not to double the dose. Okay, so that's an example of our patient teaching. Okay, what else we have there? So another patient teaching is we have copy na to. Okay, so i-adjust na to para uniform. So you can add more patient teaching dira ha. So if dili mapuno din ha sa tang dira nga column, okay? Pwede na to siya sa second column or sa third sa second sheet or sa third sheet na to ibutang. And then we will put our name. Okay, example, and then our year level. Okay, so BSN2 and the date kung kanus agi gihimo na siyang drug study, and then submitted to the clinical instructor, the name of the clinical instructor, and then the date kung kanus siya i-submit. Okay, so that's it. That's how we make our drug study. Okay, so naay copy sa drug study nga ako ang i-upload sa ato ang Canvas. Okay, pwede to siyang gamiton ninyo. Okay.